Hello friends, welcome to Medicine 101. Today we'll talk about from the anesthetic aspect. So basically we know that three types of the anesthetic drugs. We know the local anesthesia, general anesthesia and skeletal muscle relaxants. Okay. So basically I'll focus over here today with the starting with the local anesthetic drugs. So before starting the topic in details, let's define the words. So what do we mean by anesthesia? Anesthesia means the loss of sensation, and local means we need to use the drugs localized, okay, or particular organ, a particular place where we need to do the surgery or any type of the things just like this, okay. So the local anesthetic drugs. Now see one thing that when you are saying the local anesthetic drugs, the drugs are basic in nature basically. So the drugs, they are basic in nature. That means if we just see, for example, composition just like this AOH. So there should be the hydroxyl group over here, okay. Now how do they work? Okay, if you want to just need to know about them, the functions or the mechanisms. For example, it's the what? Parts of the axons. Okay, it's the axons. Where we'll see that whenever the depolarizing, electric event will come over here, then the action potentials that will go through these regions. Okay, the action potential that will go through these regions. Okay. Now see one thing within these axons here, we'll talk about the special channel that is known as the sodium channels. For example, over here I'm showing you this one. So there when there supposed to be the sodium influx within this part. After that we will see the action potential will go more accurate within this along with the axons. Okay. Now whenever we are using that, this basic in nature, but we know there is a little bit acidic medium over here. Now if you want to make the drugs to work over there, then we are supposed to make the medium what first basic medium. That's why along with these drugs, for example the anesthetic drugs, it will go over here, cross the membrane. Before that we need to make it the lipid soluble. After making its lipid soluble, this drug is able to cross the membrane. So whenever they are crossing the membrane, after coming over here, we need to make the medium basic. Okay, that's why along with the along with the local anesthetic drugs, we should give some bicarbonate. Okay, we should add some bicarbonate. For example, I am adding over here sodium bicarbonate. Now whenever I am adding the sodium bicarbonate over here, okay, then we'll see this will be dissociated into a cation and this normally with negative. So okay, minus. Now there is a chances for this cation for this part that will go over here and that will what block the channel. So further there will be no action potentials that will go through the axons. So this channel that will be blocked. So the sodium that will be not able to go in the axons. As a result, we will see the depressions of this part. So whenever it will be depressed further, the action potential will be not able to go the whole regions. So no action potentials, no activations of these things will go over here. Now as far as the classification is concerned, in their structure is concerned, so we can divide the local anesthetic drugs into two groups. As far as the functional groups, or you can say the structure is concerned, first we can say in terms of the ester group, and the second we can say in terms of the amide group. Now when we are talking in terms of ester, under ester, whatever the drugs will get over here, the first drugs, it is the first drug we use in the anesthetic surgery. So it's the cocaine in local anesthesia. Then we will get the procaine. Then we will get chlorprocaine. Then we will get tetracaine. Then we will get what? Benzocaine. So see, all the drugs are ending with cane. All the drugs are ending with cane in terms of the local anesthetic drugs. Okay. Now in terms of the amide group of the drug, whatever the drugs will get under amide. So let me write it over here. We'll get the lignocaine. We'll get bupivacaine. We'll get also the prilocaine. There are many more drugs as well. Okay, so these three you are supposed to know. Okay, now let's talk about the each individual drugs. Okay, now if you talk about in terms of the ester groups of the drugs over here, the first, there is a differentiation in between the four group drugs and the first drugs. We will see. The cocaine is the drug only under the ester group that can cause the vasoconstriction. So whenever it will cause the vasoconstriction, that will lead to the formation of hypertension. But rest of the drugs are under the ester group except the cocaine. That other drugs they will cause the vasodilations. So whenever they will cause the vasodilations, definitely they will form the hypotension. So blood pressure that will fall down over here. Okay, and we can remember one more thing: this chlorprocaine, that is a short acting. It is short acting drugs. Now, whenever we will talk about the amide groups of the drugs, let's talk about first the lignocaine. So lignocaine is the most commonly used drugs in the local anesthesia. The most commonly used drugs. Okay. Now, this drug is also good, but that can cause the cardiac toxicity. That can cause the cardiac toxicity. Now, what about the prilocaine? That will cause the formation of methemoglobin. So we'll see over here that methemoglobin formation. As a result, we'll see the hypoxia will be over here. So further the complications like the necrosis in the pathology, I think I have already read these parts. Okay. Now the problem is over here. For example, there is a person who got injury in these regions. Okay. Now, whenever using the drugs, basically we use through the subcutaneous route, intravenous. So, whenever using the drugs, okay. So, through subcutaneous route, okay. Whenever using the drugs through subcutaneous, there is a chances whenever the drugs will come over here through the circulations, okay, throughout the circulations, these drugs, for example, let me show you this part. Yes, for example, these drugs will come over here, they will work, but there is a chances for the drugs to go through the circulations in the different tissues, and they will cause the or anesthesia in the different tissues. Okay, except also the desired one. Now, what can we write it over here? Through the subcutaneous route, it can blood circulations. It can come within the blood circulation, and from the circulations, they can go to the different tissues. For example, they can go within the cardiac part. So that can cause the cardiac toxicity. That can go to the where, for example, that can go within the brain. So if it goes within the brain, that will cause the neurotoxicity. Now, to prevent these things, whatever the alternative methods or preventive method you can use over here, if you use any drugs, okay, for example, if you use any type of the drug, that will cause the vasoconstrictions in these regions. If it causes the vasoconstriction in this region, then there is a chances for the drugs to work within these regions for longer durations. Okay, that's why you will use, along with that local anesthesia, you should use the what? Adrenaline. Okay, so adrenaline, that will cause the vasoconstriction. So if we write it over here, that we should use the adrenaline. So local anesthetic drugs plus adrenaline. Now this adrenaline, that will cause the vasoconstriction, and whenever it is developing the vasoconstrictions, there is chances for the local anesthetic drugs for longer durations. Okay, so action duration, that will be increased over here in these cases. Okay, the action duration, that will be increased in these cases. Now there is also some problem. For example, if we use in case of the end arteries, end small arteries, for example, if I want to show you in this part, just try to understand from here. For example, the normal organs. Okay. now we are using the drugs adrenaline over here, and these are the small end arteries. So there is a chances whenever you're using the drugs, for example, so you are just causing the vasoconstrictions in these regions. After that, there is some chances for the drugs to go within these regions. So through this part, they will go to the what end arteries, end artery. That's why in the portions where the end arteries are present, there we are not supposed to give the local anesthetic drugs. End arteries means we can classify in terms of the tip of the nose. Okay, tip of the nose. We can use the pinna, the external ear. Okay, we cannot use the these drugs. Okay, and also along with that we cannot use in case in terms of the pains. So don't forget about these things. So this was all about the local anesthetic drugs. Okay, let me say once more. The drugs are basic in nature. So whenever it will be basic in nature, we need to make them medium basic. So along with that, local anesthetic drugs, we should use some bicarbonates. So here we have used the sodium bicarbonate. After that, it will be what? It will be dissociated into positive and negative. So this A positive, or we can say the cation, that will go over here, and that will block the sodium channel. So there is no chances for the sodium influx. So the action potential that will be stopped. So there will be no further activations of the nervous systems. Now, in terms of these parts, I already said what types of the in terms of the lignocaine, it's most commonly used drugs. In case of also the arrhythmia, in case of the arrhythmia, we can also use the lignocaine. The bupivacaine, this drugs is having the cardiac toxicity, and the prilocaine that is having that is reasonable for developing the methylbutyl formation that will lead to the hypoxia, and that will cause the further problems. So it was all about the local anesthetic drugs. So if you understand, please do like and subscribe my channel. And don't forget to comment if you don't understand.